Faster treatment for postpartum depression. It doesn't require drugs or even talking to a therapist, and its development is coming from an unusual source, the Department of Defense. It's called St. Neuromodulation, and research has found that in fewer than 3 days, 79% of patients have seen results. A new trial at UT Austin is inviting new moms to test out this solution. KXAN senior science reporter Eric Henriksen takes a closer look at those results.
We're applying stimulation to the motor strip of the brain.
This device is helping unlock joy.
And we're looking for twitches in your finger.
UT Austin research associates Ambreen Rana and Ryan Donovan showing us how St. Neuromodulation, personalized brain stimulation therapy, works.
And the patient can just be right there.
Women are at risk for experiencing an episode of depression during the postpartum period at greater rates than at any other point in their life.
Dr. Jeff Newport leads work on the project, which works similar to electroshock therapy, which
probably remains the single most effective treatment for depression that has ever been developed.
This new technique uses magnets as opposed to a shock, is precise, and doesn't cause seizures.
The worst side effects are generally speaking going to be some discomfort where the magnet is held up to the head.
The treatment itself takes 5 days, Monday through Friday, with each day taking about 10 hours. A 10-minute session followed by a 50-minute break. Funding for the clinical trial comes from the Department of Defense.
When you think about how our military force has changed in the decades, it makes some sense that the Department of Defense would have some vested interest in pursuing this.
After treatment, Dr. Newport says follow-ups can continue for up to 6 months.
What's really important is not only that we see improvement or hopefully complete resolution of their depression, but that the benefit is sustained.
In Austin, Eric Henriksen, KXAN News.
And the clinical trial is looking for participants. Women must have given birth within the last 12 months. Depression must begin during pregnancy or 4 to 6 weeks postpartum. Of course, you can learn more about signing up in this story at KXAN.com.